What is cervical cancer?
Cervical cancer is a cancer which arises from the lower part of the uterus, which projects into the vagina of a woman.
What causes cervical cancer?
The main cause of cervical cancer is prolonged infection with human papilloma virus, which might have infiltrated the cervix during infections or due to multiple sexual partners or due to unhygienic conditions.
How can cervical cancer be prevented?
Cervical cancer can be prevented by early screening methods. The first and the foremost in cervical cancer eradication is screening. Women who are sexually active above the age of 21, as recommended, should always be screened for cervical cancer. This is the only way to pick up cervical cancers very early, because the incubation period, the time from the incubation of HPV virus into the cervix, from that time to development of cervical cancer as such takes about 10 years time. So, considering the risk factors that a woman has who might be having a sexual relationship with multiple partners, or who might be having unhygienic conditions, who might not have treated her infections very often with white discharge, or multiple times she might have had an infection, she might not have approached any doctor. These kind of patterns might stimulate a HPV virus to incubate in same place repeatedly, cause an erosion and establish itself and develop as a cervical carcinoma. So, screening is the most important method to prevent cervical cancer. Regular screening at the interval of 3 years is recommended.
VS Hospitals. Care, cure and compassion.